Hi everyone, welcome to my channel. My name is Imelda. I'm a family nurse practitioner. This channel is called MEMP Digital. First of all, I'm going to ask you to subscribe, share, comment, like, hit the notification button, and come back because I always have good, details. So today we are going to talk about the famous angina. Talk about angina pectoris. What is it? It's chest pain. It's chest pain for anybody that is not clinical here. Chest pain, when people say they have chest pain, it could be from the emergency chest pain that can lead to heart attack, or it could be ordinary maybe GERD, like acid reflux. So let's dive in. So chest pain is when people have imbalance of oxygen and blood supply in the heart. What causes it? It could be because of clots. It could be because of blood plaque. Plaque, that means cholesterol. Alright, so questions you need to ask your patients for clinicians that are going to watch this video is the frequency of the chest pain and the severity, the number of nitroglycerin they've had during the episode. Now, for people that are not clinical, do you have pressure in the chest, heaviness, squeezing? That is very important to know. Squeezing, heaviness, pressure, burning sensation. So those are really important, and they're not going away. You may want to, if you don't have nitroglycerin and you don't have any prior history of cardiac issue, you may want to go to emergency room right away or call 911 if it's that bad. Localized or radiating, is it in one place? Or let's assume it's on the right. Okay. Or is it on the left and it's going to the left arm, the jaw, you're feeling like dizzy? Call 911, please, if you don't have nitro to take. Nitroglycerin is a medication that people put under their tongue. It helps to relieve chest pain. Alright. What triggers this pain? That's what you want to ask the person. Is it because of physical activity? Are they eating? Is it exposure to cold or heat? Are they emotionally stressed, like something going on in their life? Is the chest pain lasting 1 to 5 minutes or less? Does it relieve with rest or nitroglycerin? Those are a very important questions. Now, if the chest pain is sustained and nothing is helping, you're taking nitro is not helping and the rest is not helping, call 911 please and save your life. Now, there's one they call angina decubitus. It's a chest pain that happens at night when people are in recumbent position. They're laying on their back or they're on their side, they're laying flat. Physical examination you want to do when you suspect chest pain is, there's something I want to point out. When people have chest pain, do they have a Levine sign, like a fist to the chest? They're telling you, my chest hurt, my chest hurt. You want to be very careful. That is a true sign of chest pain. Fist clenched over the sternum when describing discomfort is suggestive of angina pectoris. Signs of abnormal lipids or diffuse arteriosclerosis may be noted. That's why it's very important to control cholesterol, because there's too much plaque. If it disrupt, sometimes it can travel, go to the lungs, may even go to the heart and cause heart attack. Like I said, abnormal lipid. You have to examine the patient to see if they've had a prior heart attack. Examination of patient during the angina attack may be more helpful, right? You see if the chest is chest wall pressure, if they have a chest wall pressure, or to see if it's chest cardiac origin or if musculoskeletal, like the muscle, the bone. People that are not clinical here, So, like I said, do they have abnormal cholesterol, elevated cholesterol, lipid metabolism? Do they have xanthelasma? Do they have xanthoma? Like fat deposits. See, fat deposits. If you see people with fat deposits, they may have abnormal cholesterol. Absence of or diminished peripheral pulses. They have peripheral vascular disease because of long-standing hypertension, or do they have other issue that could be, do they have diabetes? Because sometimes people have vascular disease because of diabetes. Do they have increased light reflexes or AV nicking, arteriovenous nicking upon eye exam? Do they have that because of long-standing hypertension? They have risk for a heart attack. You know what I mean? Do they have carotid growth here? They put it, you put the bell here and you hear bruit. It's not supposed to be there. That put them at risk for stroke and MI. Do you hear the third or fourth heart sound? Those are not, they are not supposed to be there. Third heart sound sometimes can be benign, but most likely is S3 is a sign of heart attack or heart failure. You know, not heart attack. No, that sound is heart failure. Fourth heart sound, because they have a long-standing hypertension, so they have left ventricular hypertrophy. So it's a sign of left ventricular diastolic or systolic dysfunction. Do they have mitral regurgitation because they've had papillary muscle rupture because they're having MI? They have a muscle rupture and the blood is now going from left ventricle to atrium because the flap is loose now and blood is regurgitating. So those are the things you want to consider when you do that your assessment. You're going to get a quick EKG. If you see a Q wave, that means they probably had a prior MI. So do they have ST elevation and ST depression, abnormal T wave? Those are the things that you need to consider. If they have that in your setting and it's not an emergency room, you send them to the emergency room right away. Cardiac stress tests, so those are important. So you have to deal with those. Are done out, cardiology or special clinics. You have to consider a history of anxiety, cocaine toxicity, cholecystitis, that's gallbladder disease, sometimes imitates chest pain. GERD, which is acid reflux, people eat, food comes up, imitates chest pain as well. Do they have pneumonia? Do they have costochondritis? That's the one I was telling you, the muscle. People, they lift, they think, they lift a lot. Sometimes they have pain, but it's not really a true chest pain. It's a costochondritis. Do they have esophageal rupture, esophageal spasm, and they feel like they have a chest pain? Do they have history of herpes? Sometimes because it's in the nerve and it's not going away. Sometimes they have pain in the region, trigeminal nerve, and it radiates to the chest. They think they have chest pain. Do they have pneumonia with pleural involvement? Lung, so sometimes they can have chest pain. Okay. So when you get that chest X-ray, you check. They have cardiomegaly. Maybe they have prior MI, prior heart attack. Ischemic cardiomyopathy, that's a red flag. Pericardial effusion, acute pulmonary edema, red flag. You send them to the emergency room right away. They have calcification of coronary arteries. This will correlate with coronary artery disease. They have stress echocardiography. I know you're not going to get this, but depending on your setting, then you may want to get this, depending on your setting. Left ventricular function, those are the things that need to be checked. Cardiac dimension, valvular disease, but I will leave that one to cardiologists. Okay, so what do I need to say? Okay, so when you get that EKG, do you have a horizontal down or down slope ST segment? That basically, let me not speak too much. ST depression, that is at least 1 millimeter. ST depression, it's not a good sign. ST elevation, not a good sign. So when they have that, you may want to withhold the beta blocker, pausing for 8 hours before the cardiac stress test, but you're not going to be doing that in your setting. You leave that for the special T clinics, right? Okay, so now when people have chest pain, what do? They said you give aspirin, right? You give aspirin, 75 milligram to 165. Clopidogrel is another one if the aspirin is contraindicated. AC inhibitor is good for people with less than 40% ejection fraction, right? So it's good for diabetes, left ventricular ejection fraction, like I just said, 40% or less. Chronic kidney disease, you give them unless contraindicated. They have history of angina. They cough on AC inhibitor. You may want to change the class to a different class, or don't even start that at all. There's another one they call ARBs. It's recommended for patients who have indications for but are intolerant for AC inhibitor. I would rather go to a different class. Beta blocker should be prescribed as initial therapy for relief of symptoms. Calcium channel blocker you want to treat lightly. Nitrate is very good. You give them nitroglycerin to help improve pain. right? Put it under the tongue. They take it. There's a way you take it. Take it. If it doesn't help you, you call 911. Maximum dose is 3 doses, but I would just encourage you take the first dose and just call 911 and save your life, right? What else do I want to tell you? I'm going to wrap up on this chest pain. The next video I'm going to talk about UTI, urinary tract infection, and how you treat that. Okay? All right. I'll talk to you later. And I'm going to ask you to share, subscribe, like, hit the notification button, comment, and come back. Thank you. Bye.